Hi, Ms. Gibbons.
Hello.
I'm your occupational therapist today. I'm Amber.
Nice to meet you.
So, occupational therapy is just all about getting you back to your daily living activities, things you like to do after your hip surgery. So, I'm sure there's activities, chores, hobbies that we would like to do without being in this chair. So, as you go through your recovery process, I will be helping you just adapt and get used to what we're working with right now and hopefully get you back to doing what you want to do.
Okay.
So with occupational therapy and your hip surgery, I'm going to help you through a bunch of different things. We're going to start with an evaluation, and we're just going to do like a pain assessment, a skills assessment, kind of get a baseline to see where you're at right now. And then we're going to move forward from there, and we're going to start an intervention plan, which is going to be filled with different things. We're going to do dressing, bathing, moving around the house, and different activities that you like to do. And it's going to be a lot of client education because we do have a lot of precautions, and there's going to be a lot of different things that we need to be mindful of with our new with our hip surgery. And we're going to talk about a lot of different tools that we can use. We're going to talk about a hip kit in a little bit, which is different things that we can use to make your life a lot easier. And we're going to talk about mobility and moving around with your different precautions. So today I just want to talk about your precautions, your weight-bearing precautions, and the hip kit that we can use. First, with your precautions, we want to make sure that our body is like aligned in between. We are not moving our knees together, we're not crossing our legs, and we do not want to be bending forward at the waist.
Okay.
So these are going to be really mindful of at all times. Crossing our legs is a big one, or even when we're trying to keep our hips at 90 degrees. Things we don't think about is bringing our legs up. So that's going to change that 90-degree angle. And then if we're like even sitting in a chair that's too low, or going to the bathroom in a chair that's too low, that's also going to get your hips out of that 90-degree angle. So we're just going to look at different things and make sure that we're aware when our body is moving around, how to keep it in alignment. Your weight-bearing precaution right now is non-weight bearing. So we are going to be mostly seated a lot. We're just not wanting to put weight through those hips yet from the doctor's orders. So we're going to learn different transfer techniques to get you out of the bed to the chair, to the commode, or whatever we need to use, so you're not having to actually put weight through your legs, which is going to be great. And hopefully we'll start moving up, and then we'll adjust to different weight-bearing tolerances. So in our hip kit, we have a lot of fun tools. So we can just go through some of these. The sock aid is going to help you get your socks on, and we're going to start getting dressed a little bit more by ourselves, kind of keep you moving around in your daily activities. And this is going to stop you from having to bend forward to put your socks on or bring that leg up.
Okay.
And it's that same thing with the shoehorn. It's going to get you that distance in between from not having to bend over to get your shoe on or bringing your leg to put it up. When we're dressing, still trying to avoid that getting out of that 90 degrees. So it's going to help you pull up your pants, all of those things. And then the reacher is another good tool to use. Sometimes a dressing stick can be a bit tricky. So this is going to help you get that distance, or if we're dropping anything, we want to be more independent, start picking things up on our own, even reaching things above us. This is going to get us there. And then when we're bathing, this is another big one. Trying to avoid getting out of those 90 degrees, getting our legs, bathing, going around us, just not reaching, crossing our legs, stuff like that. This is going to help us to stay in alignment. There's also other tools that we have, like when we're positioning in bed, because it's all about those precautions. We have like a wedge that can go in between your legs, making sure we're not bringing our knees in and touching. That's going to keep you positioned. We can also do some pillows and stuff like that, just so you're most comfortable since you are not weight bearing. We want to make sure that you're comfortable as much as possible. So if we don't have any questions.
I don't think I have any questions.
Perfect. So we're going to keep continuing treatment. You're going to see me a bunch, maybe 1 to 2 times a week. And we're just going to keep working on all of these different new tools and modifications that we're making to your daily activities so that you can start doing self-care on your own. And then they'll keep adjusting as your weight-bearing tolerance adjusts. And then hopefully we'll get you independent out of here and you'll be going back to your daily life.
Okay, awesome.
Thank you.